This is a topic that we don't have on our regular Burnette risk management seminar schedule, but when Keith reached out to us and said, "Hey, this is a topic that a lot of folks need help on," I just thought, well, duh, yes, it absolutely is. And if you've been around long enough, you know that Medicare is such a challenge on so many levels. And really and truly, finding someone who you trust in this space is, I would argue, to be one of the most critical elements of understanding Medicare. So finding guidance, finding someone who's qualified, who's capable, and a trusted resource is really such a huge thing. And for us, Keith and Affordable Medicare Solutions have been that partner for many, many years. Keith and his team are actually neighbors of ours at Burnette and are just right down the street from us. And Keith just reminded me that they've been in business for over 30 years as an agency. And so anytime we get Medicare questions, we turn them right over to Keith, and he takes good care of them for us. So we'll be relatively short today. I think Keith has some great information for us, and we're actually going to do another Medicare focused seminar webinar in November. So be on the lookout for more information and to follow up on that as well. But Keith, I'll go ahead and turn it over to you, and look forward to hearing what you have to say. Thanks for your time.
Thank you very much, Jared. I look forward to doing many of these types of education classes for you, because there's so many pieces to Medicare that, whether somebody's working, whether they're retired, they're thinking about retirement, are they, all the different parts and pieces of Social Security and Medicare can really get confusing. And there's a lot of bad information, a lot of unintentional errors that are made. And so we have a YouTube channel that I have built over the last 4 years, a blessing of COVID, I call it, because today we're going to talk about one subject, but we may not cover the subject matter that Betty or Tom or anyone else exactly wanted to hear. So I want to share first, before I even tell you about me so much, is I want to share my screen and show everybody the YouTube channel. So the YouTube channel is great, has a lot of information, and there's videos and shorts and playlists, and you can see all different types of information. Well, some of the information on here is also put on our social media, on our Facebook and Instagram, such as these Medicare Minutes, but there's longer videos such as Medicare Soup to Nuts and Medicare 101. There are common Medicare questions and answers for working employees, easy steps for reviewing your prescription drugs here at the annual enrollment period, signing up for Medicare through Social Security. The list goes on. And I put up a new video about every week. So there's going to be tons and tons of information here, including our own little commercials about who we are. So instead of watching a video, I'll tell you who we are. Affordable Medicare Solutions is Georgia's largest and most award-winning Medicare planning agency. We're not a sales agency so much. We do help people enroll in Medicare plans, but we help people manage their Medicare year to year, because Medicare is not set it and forget it. You don't sign up and you're done. It is something that you do need to address every year, especially on the information we're going to cover today, which is the impact of the Inflation Reduction Act, Biden's signature piece of legislation that really impacts Medicare beneficiaries and is causing a huge amount of disruption in the market this year of Medicare, not only in prescription drugs, but also under the Medicare Advantage, HMO, and PPO market. Big impact. So I'm going to get started, and we're going to be able to take questions. We're also recording this class so that people can go back and watch it again, and also share it with people who had to miss today. So this will also be the start of many classes that we will do over the years to do different topics, whether people are an HR person, a retiree, an employee, or maybe a dependent, or taking care of an adult parent that they have to take care of. So there's all different levels of Medicare situations that we handle. So let's get started. Changes to Medicare RX coverage in 2025, pros and cons. The key changes to drug costs and coverage with implications for Medicare. I am Keith Knabb with Affordable Medicare Solutions. This is a public service. All of our services under Medicare are free. There are no charges, and we're happy to help all populations under Medicare. This presentation is for educational purposes only. I'm not employed by Medicare. I always do this as a public service. We've done over 1,300 classes on Medicare, and your complete information is always available at medicare.gov. Never, ever go to medicare.com, because if you do and you put in your information, they are going to put you on telemarketing lists and email lists, and you're going to get hounded. It is a crime for somebody to own medicare.com other than the government. So make sure you go to medicare.gov to create your account, and you can get other information there, and also at my own website. You can go to our website, which I'll give at the end of this presentation. We're not going to talk about any company names, plan names, or prices today, because this is an education class, and I do have additional educational flyers with detailed information available at our website and at our YouTube channel. Affordable Medicare Solutions has done this for 30 years. We have 10 professionals about a block away from Burnette Insurance's offices in Suwanee, Georgia. We do represent the client and not the insurance companies. We are brokers of the entire market. All of our services are free. We are paid by the plans, so you do not have to pay us through Medicare requirement. Medicare requires the plans to pay us under the contracts. Our agency serves all of Georgia and is the most award-winning Medicare agency in Georgia by far. Medicare is not set it and forget it. I'll say that again. It's not set it and forget it. A big mistake would be to not manage your Medicare financially and health-wise. And the reason is that changes happen every year. Either your plan changes or the government makes changes, and both things are happening this year. There's also new help, expanded help for low-income people, and also expanded help for people with chronic illnesses. New options available. Yearly changes to the plans can affect your out-of-pocket cost. Medicare changes deductibles. The plans can change the drug costs, either up or down, which doctors, providers, which pharmacies you can use, which hospitals. And then also we're seeing massive changes in the extra benefits under some Medicare plans, under dental, vision, groceries, hearing aids, transportation benefits. We're seeing a lot of changes for 2025. Big changes this year due to the funding changes. So what is the Inflation Reduction Act? It's a multifaceted piece of legislation that they've passed because they could not pass the Build Back Better bill. That was a $7 trillion bill that was never going to get passed after we spent $6 trillion in COVID. They tried to do another $7 trillion and Congress said no. So they passed the Inflation Reduction Act, which is $1.7 trillion, and it has huge implications. The buzzwords used are supposedly reduce inflation, lower healthcare costs, combat climate change somehow, tax equity, economic stability, and social equity. I'm not sure what some of those mean. So the changes in Medicare drug coverage is what I deal with. I deal with Medicare, and I have dealt with Medicare drug plans since 2005. I was in the very first class of 40 people here in the state of Georgia to be trained on Medicare drug programs and how to help them with the consumers. It made a big impact on my career to have people near tears to get drug coverage. It was a pretty amazing time because Medicare did not cover drugs on an outpatient basis until 2005, which is just crazy to think about. Under the Inflation Reduction Act, they are now going to negotiate drug prices. And this is because the United States pays 2 to 3 times what other first world countries pay for very common medications. It's ridiculous. The first 10 drugs have been announced. A good example, the first one announced was Eliquis. Eliquis is a blood thinner after you've had heart surgery or a blood clot. And it's $500 a month here in the United States, and in Canada, it's $50 a month. It's a 90% difference. We've been getting ripped off, at least over the last couple of years, whereas other countries have it much cheaper than we do. So they've targeted 60 drugs that represent about $60 billion of excess Medicare spending. The Veterans Administration are already giving these drugs cheaper. I think California and New York are trying to negotiate them also cheaper for their Medicaid programs and things. The timeline is 2026 to 2029. I think they're going to expand that timeline. And this is important. It's not just going to be 60 drugs. They've just announced 60, but they're going to go after more drugs than that as they come along. And we'll see what the industry thinks about that. So the price caps and limits, usually when you hear the word price cap, that can have a negative connotation. Here it's a good connotation. It is a $2,000 cap on your out-of-pocket drug costs under the Medicare drug programs. So those are called Part D, as in drug, prescription drug plans. This year in 2024, it was $8,000. So we're going down from $8,000 to $2,000, which is huge for fixed income seniors to know they're not going to, go into debt or bankruptcy over their prescription drugs, that their worst case they're going to get hit with is $2,000. Now, your drug spending might be millions of dollars, but your personal spending is limited at $2,000. That's a big deal. The insulin price cap that President Trump created, which was $35 monthly cap on insulin prices, unfortunately wasn't complete. It excluded people using insulin pumps and other things. So when President Biden came on board, he loved the Trump insulin program and he expanded it to include people using insulin pumps. And this has been very, very popular program. I had clients spending $400 and $500 a month on insulin, and now they spend $35 a month. But even so, some beneficiaries are actually paying $12 or less, not $35 even. They're paying even less, a third of that for their insulin, which is fantastic because 5% of people spend half of Medicare's dollars, and a significant number of those people are people with diabetes and other chronic illnesses. So the impact on drug prices, we're expected to see reductions in prices due to these negotiations. The first round of negotiations were successful, but the counter argument is we're still paying 2 times what other countries pay, maybe not 3 times, but they're working on it. And the industry is fighting back tooth and nail. There are price inflation penalties. There are penalties for drug manufacturers that increase their prices faster than inflation. So if a drug manufacturer increases their drugs more than the inflation, the government will ask for a refund. And if you've got 1 million people on that drug, it could be a big refund to Medicare. Tens of millions of dollars of rebates on just each drug, not in total, but on each drug. We're already seeing the effects of this threat. We're seeing some pulmonary medications and insulin prices coming down for the general population, not even just the Medicare beneficiaries, but we're already seeing some drugs from AstraZeneca, GlaxoSmithKline, Pfizer. They're already announcing some new lower prices on breathing medications, pulmonary medications that aren't even part of this negotiation. Goals for the Medicare beneficiaries on this is, of course, cost savings, and also to announce it during an election year is very important. They want to make sure that have a big impact during an election year. They want to improve access due to lower prices. This is important. If somebody doesn't take their drugs, then their healthcare is not functioning properly. And people were splitting their insulin up into smaller doses. They were skipping doses of Eliquis. When you don't follow the compliance of your doctor and your drugs, weird things happen because you're not following the protocols. So we're hoping that people are going to adhere to their medication schedules much better, which means there'll be fewer people ending up in the hospital and spending exorbitant amounts of money instead of smaller amounts. These potential improvements in health outcomes would be hopefully better access and adherence. Of course, the bottom line is let's not waste money on unnecessary hospitalizations and treatments. The challenges and criticisms of this act, some critics have already called this the Inflation Production Act. We'll see if that's true. There is a huge implementation challenge. Some bureaucrats got to thinking about this and said, well, wait a minute, what if our lovely 70-year-old client voter all of a sudden gets a $2,000 bill in January or February for their drugs, and that we know they're going to be good because they have 100% coverage after that, but they might not be able to swallow $1,000 or $2,000 bill in 1 month. So let's smooth out their cost of that $2,000 over 12 months. So out of the blue, they just decided to create this provision, prescription drug payment program, where they would just require the pharmacies and then the plans to create free loans to the beneficiary, to the person taking the drug. So you can just raise your hand and say, I want a free loan. They'll give it to you, and you'll pay back $167 per month over 12 months. And that is 12 times 167 is $2,000. But you have to opt in. It's not automatic. So you have to raise your hand and opt in. And agents like myself cannot help you with that. The pharmacy and the plan are required to help you. Well, pharmacies and insurers are completely ill-prepared for this. They're going to be getting phone calls in January, and it's going to be a complete mess. Pharmacies already are overworked, and now they're going to be asked to do this new unfunded work, and they're going to be mad. My pharmacy is very busy that I go to, and so we're not having high hopes that this is going to get out of the gate very easily. And if somebody fails to pay their $167 a month, they're going to be kicked out of the program. Well, does that mean they can't pick up drugs? We don't know. So we're wondering how this smoothing provision is actually going to go smooth. It's kind of an oxymoron, which is not surprising. Pharmaceutical industry has opposed these changes. Of course, this is affecting their stock prices and their bottom line. They don't like cutting the prices of their expensive drugs here in the United States. They've already cut them worldwide, but their last place to make good money on them is the United States, and they're mad. Lawsuits by the industry are already being filed. A couple of them have been thrown out already, but they're still trying to stop this negotiation. The economic considerations. Here's some economic considerations that are happening. We expected, and sometimes this is true, that the drug plan premiums are going to skyrocket. Well, they were really gonna skyrocket. And the government heard back from the plans in about July that the premiums were going to triple in an election year, and people were going to get notices in October about their premiums tripling. So the government immediately went into panic mode and just immediately created a program to triple the subsidy to the pharmaceutical plans, to the insurance companies, so that they wouldn't triple their premiums. Well, Congress is really mad about this because they didn't appropriate the funds. Medicare just pulled it out of thin air. And there's a lot of congressmen, 50 of them, I think, that have signed off and saying, wait a minute, you can't just spend money without our approval. So we're kind of wondering how this is going to shake out. But we're actually seeing some drug plans go down in price considerably, and other plans are going up in price. The national average is definitely going up, but we still don't have the exact numbers. We will by October 1st. But some people are going to get some ugly surprises where their drug plan went from $50 a month to maybe $90 a month, or from $20 a month to $60 a month. So they're already, we're hearing that some drug plans are not renewing at all. We used to have 30 drug plans 2 years ago. We had 20 this year, and now we're going to have about 10 drug plans for 2025. That is fewer plans due to this law. But the bigger economic risk is what happens when people go to the buffet. When you spend your $2,000, there's nothing to stop you from spending any more, because it's the bonus round. You get 100% coverage from that point on. If you spend all your drug money out of your pocket in January for $2,000, the rest of the year, any drug that is covered by your plan that you want is going to be covered at 100%. So we're really wondering how much overspending this will actually create. Just like going to an all-inclusive resort, you're going to go to the buffet more often than if you were having to pay for each meal. Will this cause the RX spending to balloon? Probably on brand name drugs, not on generics. The generics are already fairly inexpensive, and that's 85% of Medicare spending is generic drugs, but the other 15% are huge. And we're wondering if that'll balloon those drugs. The industry will find creative ways to get doctors to pay attention to this effect. And there's a massive incentive to not use GoodRx or cost plus drugs or Publix or Walmart to find lower costs, because if you buy drugs outside of your Medicare drug program, you are not going to get credit towards the $2,000 spending. It has to be spending under the use of your Medicare Part D drug coverage. So questions and answers. There's a lot of people that have worries for themselves, but also maybe for relatives, how they're going to be affected. A lot of people have examples of ridiculous drug costs, and I'm willing to take questions and comments right now. I have clients that buy drugs from India, from Canada. They tell me all the time, "Hey, Keith, it's too expensive here. I'm ordering this one drug from Canada." I hear it all the time. A good example is Humira. Humira is a biologic drug that is 90% cheaper in the Bahamas. And the New York Times had an article this past year where self-insured companies on their health plans, they're self-insured, were finding it was cheaper to pay an employee to go to the Bahamas for a 3-day vacation and pick up 4 Humira pens, which here in the United States are $4,000 a month, for $400 a month in the Bahamas. So it was cheaper to give them a free plane flight and a free hotel stay in the Bahamas to pick up their Humira pens than it was to buy them in the United States. That is crazy, but it's true. It really does happen. Eliquis is 90% cheaper in Canada. It's $50 a month in Canada, and it's $500 a month here in the United States. So I'm opening up the floor to questions and answers. I'll stop sharing my screen. This is the name of my company, Affordable Medicare Solutions. You can email us at info@amsplans.com. You can go to our website at amsplans.com, or you can call us. And you can also go to our YouTube channel. Just search Affordable Medicare Solutions, Swanee, and it'll pull it up under the YouTube channel. So if we have questions now from any of our guests, I think we have 5 guests in here, and I'm happy to answer those. Remember, this is recorded, so please don't share any private information, just general questions. And I will unmute anyone if you would like to ask a question. All right, Jared, I don't think we have any questions. Do you have any comments yourself?
Well, no, I'm just thankful for your time. Really appreciate that, Keith. And like I said, I think we kind of got the word out a little bit later than normal on this. So I think having some kind of regular cadence and rhythm for future classes is going to be very helpful. Again, this is to so many of us who are loosely related in the HR space. It's so good to have somebody who really knows what they're doing and cares deeply about helping folks in this tricky area. So thank you for your time. I'm sorry, go ahead.
I want to make one comment to give you an example on that. Between HR and between Medicare, there's a big question now. Is the group health insurance drug component going to be creditable under Medicare? Because if you have a group plan that's got a $3,000 deductible, that's higher than the $2,000 now under Medicare. It was never a problem before because Medicare was always $7,000 or $8,000. Now that Medicare is going below the average of group plans, there's a huge question. So the government said, yeah, you're right. We didn't think about that. So they've suspended changing the rules for 2025. Anything that was creditable in 2024 will still be creditable in 2025, but they are going to create a new rule before the end of 2025 to take this into consideration because they didn't think about it, how this is going to interact between the creditability of group health insurance and when you move into Medicare.
Yeah,
so that's just one. I bet you there's going to be 25 others just like that questions.
Well, and that's helpful to folks like we've got Monty Joseph, my colleague, on the call. So as he, I'm sure gets a lot of the, questions and just bewilderment in that area. So it's great to get some of these refreshers. And like I said, I'd love to keep these going on a regular basis. So thank you for your availability and your expertise and your willingness to help in this area. So very grateful, and thank you all for joining us. And Keith did record this session, so I'm sure he'll share that with me, and I'll send this out to those of you who joined, along with some other folks who were interested but couldn't participate live. So thanks again, and be on the lookout for some more invitations to upcoming webinars.
Our next Medicare class is November, correct?
Yes, November. I think we said November 12th.
Okay, excellent. I look forward to seeing everyone then.
Okay.